At the time I was working clinically, getting some clinical experience, and then I got a call from Mary McConnell who said, "Jill, would you be interested in running the COVID clinic?" So I said, "Yeah, sure, why not? Give it a go." So that's how I landed in that role. Monday we were put together, Mary, myself and a few other key stakeholders, and we were asked to have it up and running by Wednesday. So my role on Monday was to find staff to work with me in the COVID clinic and I suppose figure out firstly what our roles would be. Would we be screening, assessing, swabbing? So I went up to day procedures unit, which is where I had been doing some clinical shifts, because I thought those staff are pretty good at doing rapid assessments, quick turnover, so I thought they would be an ideal group of staff to do a similar model down in the clinic. And not all of them were interested, as you can imagine. There's a lot of fear attached to working in the COVID environment, and I totally respected that. I'd say I managed to procure at least 3/4 of that staff group though, and got them down the next day for a 7 o'clock orientation, and that's where we started learning quickly, learning on the job of what our role was going to be the next day to open.
For setting up the COVID clinic, it was where we were going to put it. We had several locations in mind, but I think just the logistics of having it in the actual hospital building, it was just going to be proved too hard. So we decided to put it outside with tents. So even getting that up and running, it was all done so quickly. The staff that have offered to work in these areas without any hesitation, even though they must have been scared as well. So we got them, the staff, and just setting up, getting the PPE, training them to do that, training them how to take the swabs, because that was new as well for them. So it has been full on.
The day the clinic opened was really fearful, not going to lie. We weren't quite sure what to expect. We'd been trained. We had a lot of anxiety about opening those clinic doors. Lots of the people that I were working with were still not sure if they'd made the right decision about coming to work there. The first day we had 178 people come through the door, and we thought, oh my Lord, we didn't know if we could sustain that. The fear, you could feel it was palpable. People were coughing and then looking at each other, thinking, don't cough near me. Everybody got a mask as they came in, everyone had hand gel. But it was a fearful process, and it's fearful for us working in there as well.
What was paramount is that people who presented here to have their tests done on those days would obviously want to have their results as quickly as possible. So it was a two-part stage where patients, as they presented in the queue, were actually logged via a little application provided to us by WA Health. As patients presented, we were capturing the information on an app, the nurses were doing it, they were collecting just some very basic details about the patient, and then they got to a central point where what they did, the patient actually called our call line, if you like. We took down their details so we could produce a label that ultimately went on those swabs to the pathology lab.
So now, the 17th of April, the atmosphere, particularly from the staff perspective, is completely different. We got a grasp of the role, we know what we're doing, we feel thoroughly protected, both equipment-wise, resource-wise, emotionally. The hospital are absolutely fantastic supporting us, everybody has. So we feel more confident, we feel safer at work, I would say, than what we did in those first few days. Each patient's different, every morning and afternoon's different, you can never tell. You still feel that anxiety. There'll never be a shift, I think, where you go in and you don't feel that, but it's not from us. It's not from us. We try to keep it as light as possible in the circumstances.